Hi, everyone. Welcome. Thanks for joining us today for this webinar in our Pathways to Prevention series. This series is a partnership between the Injury and Violence Prevention Center and the Kempe Center for the Prevention and Treatment of Child Abuse and Neglect. I'm Sarah Brandspiegel. I'm an instructor in the Colorado School of Public Health and Director of Outreach with the Injury Center. I want to start by sharing that both of our sponsoring organizations are based at the University of Colorado Anschutz Medical Campus, which is in Aurora, Colorado. And as we gather today for this webinar, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. And we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. The Pathways to Prevention webinar series that you're joining today is designed to connect prevention workers with the latest science on protecting children and ensuring well-being of families. We're offering these free monthly webinars for those working in public health organizations, social services, child welfare, the nonprofit sector, and other types of organizations. During these sessions, you'll be hearing from researchers working on various topics in the primary prevention of child abuse and neglect, as well as adverse childhood experiences. So really glad you're joining us today. These webinars going forward are going to be held on the 3rd Wednesday of the month at 11 Mountain Time. 1 Eastern time. And we are recording today's webinar, and we do plan to record the webinars and archive them on our website. So if you miss a session or you want to go back and review something that you learned in a session, you can access that recording at a time that's convenient for you. And we'll send the link out to the recording for everyone that registered today. Before I introduce today's speakers, I'll share that our next webinar will be on October 20th. At 11 Mountain Time, and it's titled Indigenous Connectedness for Child Wellbeing. It will be presented by Jessica Sanaguk Ulrich, who's an assistant professor at the University of Alaska Anchorage School of Social Work and a tribal member of the Nome Eskimo community. And we have other monthly sessions scheduled through next February. So we'll put the link in the chat if you'd like to register for any of those upcoming sessions. And then finally, keep your eye out at the end of today's webinar. You'll be directed to a brief feedback survey, and I hope you'll take a few moments to share your feedback with us and your ideas for future sessions. I'm really excited about today's presentation, but I do want to take a quick moment to just hear who is joining us today before we begin the presentation. So I'm going to open up some polls for everyone to take a moment and just share with us, where are you joining us from? What region of the US, or are you outside of the US? And then the second question is about what sector do you work in? I put some sectors in the options here. If you don't see your sector included, please feel free to type that in the chat box so we can see where folks are from. And I'll just give it a moment for everyone to answer the poll. I see lots of responses coming in. I see folks sharing in the chat, domestic violence organization, school-based health center, a foster parent. Wonderful, welcome. One thing I love about this series is we really reach folks from a lot of different areas. So I'm gonna share the results with everyone. Let's look together. So it looks like Western US is our biggest chunk of region folks coming from, but pretty good mix from around the country. And looks like in terms of sector, 46% from child welfare or social services, and then 21% from public health. And then we also have people from community-based organizations, higher ed, other government agencies, and then I'm seeing some more responses in the chat box. Nonprofit intermediary, a CASA organization. Great. Well, thank you so much for sharing that and for being here today. I'd like to now introduce today's speakers. We're so thrilled to be hearing from 2 folks from the Children's Trust of South Carolina. We have Aditi Srivastav Bustles, who's Director of Research at Children's Trust of South Carolina. And Aditi leads mixed methods research efforts on adverse childhood experiences, racial equity, community mobilization, as well as examining policies, programs, and practices that improve family and community resilience. And she's the primary author of the organization's signature prevention framework, the Empower Action Model, which is what we'll be learning about today. We also have Dana Powell, who's the Community Engagement and Training Coordinator at Children's Trust of South Carolina. And Dana works to make sure that all family members have the information they need to strengthen protective factors for children and families. She's the lead trainer for early childhood development and responding to abuse and neglect trainings, as well as the developer and trainer on middle childhood development. Dana is also an adverse childhood experiences master trainer. Thank you both so much for being here today. I want to let our audience know that as our presenters are sharing, you can put any questions in the Q&A box at the bottom of your Zoom screen, and we're going to save some time at the end to get to your questions. So please share those, and I will now turn the floor over to Dana and Aditi.
Thank you so much, Sarah. We're very, very excited to be here today. And I know that we've had a series of webinars I've been fortunate to participate in, and we've heard about a wide range of evidence-based strategies and research activities to prevent abuse and neglect and other types of adverse childhood experiences. When I was asked if I'd be interested in doing a presentation, I knew I had to bring Dana with me, because one of the unique things about Children's Trust is that we are a data-driven organization. We do research in-house, original research, whether it's qualitative or quantitative, but then we get to work with our program partners or coalition partners within our agency to implement that work. So I would say one of the most rewarding things that I've been able to do is develop this model and see it then be implemented in a very uniquely South Carolina way. And that's what you all will be learning about today. The goals of this presentation is very much focused on two things. One, I want to give you guys a 20-minute overview of how the Empower Action Model was developed and the science behind it, right? So why is this an evidence-based model, and how you can possibly use it with your organization, entities, groups. You'll hear about different ways you can use it. And then we're going to talk to you about how South Carolina specifically has chosen to implement it. And I say that because this is our real world application. It doesn't mean it's the only way to, but it certainly yielded some lessons that I think that other groups interested in action planning would find beneficial, particularly around the topic of ACEs. So let's jump into the science. So in South Carolina, last year, there were over 20,000 kids in founded cases of abuse and neglect. And that's enough to fill 315 school buses. We also know two things. Child abuse and neglect is likely to be an underreport, so the number is likely larger. And recently, we may have seen an uptick due to the pandemic and kids going back into maybe unsafe or chaotic situations because maybe school was their haven or their safe, stable, nurturing place. But this statistic is really what I think drives our passion for prevention. We believe that it is our role to ensure that every child lives their best life and meets their full potential, whatever that may be. But in order for us to truly prevent something, we can't just prevent the bad things, we have to promote the good things. And for the longest time, even today, and this is not a dig, Sarah, I promise, but even today, when we had you all fill out that poll, child welfare and public health are separate. And that was actually by design when you think about funding structures of how you have a children's bureau and then you have an administration for children and families. And for the longest time, public health, social work, child welfare, these systems, while so connected in their passion or their belief in prevention, were working separately. And over the last decade, because of the ACE study, which I'm sure many of you have heard about, there's really been a shift to, well, if we really want to move the needle around child well-being, we have to promote good things in addition to preventing the bad things. And so I think that's what really drove the creation of the South Carolina Adverse Childhood Experiences Initiative. That's where this work is embedded. We've been collecting data on adverse childhood experiences since 2014. We didn't, despite the study being around for a while, ACEs really wasn't a regular term used in a lot of people's lingo, whether it was in public health or child welfare, until I would say the last decade. And so over the last several years, we have been able to gain a very strong understanding of what ACEs look like in South Carolina, which then led to us being one of the first 5 states to adopt the ACE interface training. And that is a training created by one of the original study investigators to help disseminate the ACEs science in a way that makes the most sense, that's the most relatable, and helps people really resonate with the idea that everyone has a role in preventing ACEs. One of the things we kept hearing over the many, many trainings that we did, and I think we've trained thousands of South Carolinians at this point. We have over 200 trainers across the state trained in this curriculum, is people would get really excited. They would do their own research, or they had already heard of ACEs, and they'd come to our training and they'd say, so what? I know ACEs are important. I know we need to prevent them. How do we do it? I know you talk a little bit about protective factors, but I need to know what I need to do. Can you give me a roadmap? Can you give me an idea of what to do next? What's my so what? And we started to hear that over and over again as we were training, and we realized, there's really a need for us to understand the so what piece. We know how ACEs affect children, populations, communities, and even, our future, our economic prosperity. We just aren't really sure how we implement those good things. And so protective factors have been around for a long time. There's been a lot of research to show that safe, stable, nurturing relationships and environments are really what can help a child, despite experiencing any kind of adversity, thrive. Or ideally, in the first place, they have these relationships and environments so the ACEs don't occur at all. But when you take a look at all of the different protective factors frameworks, whether it's CDC's Essential for Childhood, Harvard has one, there's a lot of great protective factors frameworks out there. One thing that we found that was possibly missing from that is, how do we actually know that we implemented this? Well, how do we know that this protective factor is in place? What is our measure for that? So that, someone can say, I did something because I know that ACEs are important and I want to do something to prevent it. And similarly, how do we actually put these frameworks to action? We know what these protective factors are. Now we need to know how we do something about them. And that was a limitation that we really found, that while we were training or sharing our work or our data around ACEs, there was really no roadmap to explain how we put these good things in place so that bad things can be prevented. And then I think most importantly, as we all started shifting towards this population-based perspective, again, going back to this idea that we have to take a more systemic approach to really move the needle on child welfare, whether it's making sure that outcomes are more equitable or ensuring that we are really making an impact that's sustainable and long-term. There was no clear understanding of how do we connect all of the great work happening on multiple levels. Some of the most important work on protective factors has been done on what we call that interpersonal level, right? The child and a caring adult. And that's really important. But we all also know that there's so many things that factor into our relationships and our environments around us. How do we connect some of the policy work or the organizational work that's being done or the community work to make sure that we're all moving resilience forward, or we are promoting protective factors at multiple levels? And so these were the internal conversations that we had for several months. We were very fortunate to then connect with our friends at the Colorado Office of Early Childhood and Chapin Hall and commission a study on developing a prevention framework and conducting focus groups. But still, we needed something that told us what that public health approach to child well-being would be. And we know that public health, by definition, aims to provide the maximum benefit for the largest number of people. And so one of the things I like to say is ACEs are not just about children. They're not something you should care about if you are a parent or that you have children, right? ACEs are something that everybody should care about because everybody's had a childhood and everybody knows a child. And when we all care about something, we know that everyone benefits. And so there was really a need for us to move into this public health approach. And so there was a lot of great things going on. We had these ACEs trainings happening, talking to our partners and stakeholders about, what they need in order to advance prevention around ACEs. We had these great partnerships with Chapin Hall and Colorado Office of Childhood, where we had done a lot of research around parents and protective factors. We had a great understanding of the protective factors framework, and we wanted to bring that all together. Our intention was never to create more of the same. It was to advance what was already there. And so I always want to take a moment to appreciate all of the incredible work that's been done around prevention and resilience prior to this model, because it wouldn't be possible without it. And I think the unique piece of our model is that action-based perspective. And so as we started to think about what we needed, we knew we wanted an evidence-based, research-based model that made sure that people had a roadmap or an action plan that could be developed. They had the so what piece. And so that's when we really started looking at a lot of work that had happened before us. And that included things like the protective factors. And the call from the community was really, how do we do this? And how do we do this if we only work in the policy space, or we don't work directly with children and families, but we want to do something about it? And that's really the idea of where we realize we need the social ecological model as well. The life course perspective, which is, again, ACEs are not just about kids, but it affects everyone and across the lifespan. So how do we develop something that resonates with everyone? And then I think most importantly, we really wanted to make sure that our model was grounded in race, equity, and inclusion. This was around the time that there was a lot of work going on around the expanded ACEs. My colleague and fellow Doris Duke fellow had recently coined that term adverse community environments, really thinking about how so many of our experiences are a result of systemic and historic trauma or inequities. And so we wanted to make sure we furthered that by continuing to acknowledge that deeply rooted in the experiences that we have early in childhood are those historic and systemic inequities. So I'm going to give you a quick overview of how we brought all of these theories together and then talk about the model. So the first model is a social ecological model. For those of you that are in public health or in community psychology or a related field, this may not be very unfamiliar to you. But when we think about the goal of our model, the ultimate goal is to stop ACEs from happening altogether, happening in the first place. We talk a lot about mitigation because true primary prevention is really, really hard. But we know that if we want to do true primary prevention, it requires a multi-level approach. It requires acknowledging that there is a complex interplay between individuals, relationships, communities, and policy factors that can influence someone's behavior. And so this model really helps us understand the range of factors that either build resilience or can increase the risk of ACEs. And the overlapping rings of this model show us that all of these levels influence each other. So we knew that the Empower Action model had to be embedded at multiple levels so that people that are working at multiple levels could find their role in preventing ACEs and promoting resilience. And the most important thing about the social ecological model is that it has been shown in many other studies and research activities, whether it's around violence prevention or tobacco cessation, is that when you take a multi-level approach, your change is more likely to be sustainable and long-term. And that's the most important thing, right? That we are able to change the trajectory for future generations to come. And so the next theory that we incorporated was a life course perspective. Now, this pyramid probably looks pretty familiar to you all. It was also very similar to the ACE pyramid that's used in the original ACE study. And it's really to remind us that what happens to us in childhood affects our adulthood. And so therefore, any approaches that we have for preventing or promoting resilience, right? Preventing ACEs or promoting resilience must be across the lifespan as well. And so again, I say that this work is not just for those who work with kids. This work is for people that work with communities, with policies, and people that care about people. And so it was really important for us to continue to think about how this model could resonate even with folks that never planned to have kids, because they are able to find their role in preventing ACEs. And so the life course perspective was the second theory that was underpinning the Empower Action model. And then the third one I'll go over is race, equity, and inclusion. We could have a whole discussion about what this means. And there's a lot of great models out there around race, equity, and inclusion. And I would say since 2020, we've even seen a resurgence and renewed interest and commitment to REI. This model was created in 2018, 2019. So, one of the best resources that we found to help us understand how to be actionable about race, equity, and inclusion was the Annie Casey Foundation's Action Guide, which actually provided 7 steps for ensuring that your organizational practice or your program or XYZ thing that you're doing is racially equitable and inclusive. And again, it was important for us to make sure that if we're talking about ACEs, we're talking about the whole picture of how ACEs happen because of inequities that exist in our society. And so you'll see that it is embedded throughout the model. So we had 4 things that we brought together. Again, we brought together the work of amazing scholars and practitioners before us, and just moved it to the next step of let's do something about it. And those 4 were protective factors, the social ecological model, as well as the life course perspective and the race, equity, and inclusion. And Dana, thank you for doing that so quickly, but you can see how it all comes together on this slide. In the middle, you have the social ecological model, right? Those multiple levels of influence. And we know that we must promote these 5 protective factors that you see around it at those multiple levels in order for us to really see meaningful change and to truly then make a difference in terms of preventing ACEs. These protective factors must be implemented across the social ecological model, across the lifespan, and with racial equity and inclusion in mind, or foundational to every single action that is created. And so I'll talk a little bit more about what the protective factors are, because we looked at all of the different protective factors frameworks out there that we brought together and basically transformed into action-oriented protective factors. And so the 5 protective factors that we use within this Empower Action model is, in order for us to prevent ACEs and promote resilience, we must create positive environments for social emotional well-being. We must support children and families through positive relationships. We must build resilience through learning skills needed to manage stress and nurture children. We must share resources that allow individuals and families to meet their basic needs. And we must grow positive outcomes by promoting individual development. Again, these were based on frameworks that already existed. One thing you'll notice in here is that we intentionally include the term individual because we want those who, again, may not have kids, may not plan to have kids, to still recognize that they had a childhood and that they can also help promote resilience for their community or for their organization, and take care of themselves so that future generations are set up for success. So if we had stopped right there, if we can go back two slides to the model itself, if we had stopped right there at the Empower Action model, I think one of the things that you would find is we would have some of the same limitations as to what we saw with so many of the other great things that had been created to promote and build resilience. We're telling you these are the things that need to happen, but we're not telling you how. And I think that this next part is what makes the Empower Action model so unique. And so that is our, what we call Empower Action framework. You guys probably can't read the words in here, but no worries. We will share the paper, the peer-reviewed publication that includes this in the paper, so you can follow along, and you can also email me or Dana at any time, and we're happy to share some of the resources. But this is that roadmap that I've been talking about. We know that there are many, many different ways to achieve resilience. But one of the things, again, that we found was a limitation of previous frameworks was that there wasn't an end goal that could gauge that we had implemented this good thing. And so what we decided to do was what we call create optimal conditions that any group could achieve in whatever path made sense. We wanted this model to be flexible so that it can appeal to and fit the needs of varying contexts, varying regions, varying sizes and organizations. But we also wanted people to have an understanding of this is what should happen if you implement these good things. So you can see down the left-hand side are our 5 protective factors. Across the top, we have the levels of the social ecological model. And across the bottom are what we call our race, equity, and inclusion tenets, which is all of your actions should be grounded in these things to advance equity while promoting resilience. So let's look at one example of how you would use this model. Say I am going to promote resilience and equity and prevent ACEs at an organizational level. Say I don't actually, deal with kids and families, but I know that it's important for us to support the families that work for my agency. My agency only operates on $10 million a year. It's a smaller agency, and the end goal, if I'm going to implement this protective factor, which says that I need to share resources that allow individual families to meet their basic needs, the end goal at the organizational level would be that we have created an atmosphere where employees can access resources in times of need and for self-care, and that our practices and policies are all racially and culturally inclusive, meaning the resources that we've created are actually relevant to the families that we employ, and that we are really valuing the diversity and perspectives. So for a $10 million agency, maybe that's, providing a couple of sessions, for free to employees and their families, or expanding healthcare benefits to include mental health and wellness, or bringing in, special practitioners once in a while to provide self-care in the office. That would look very different than, say, if I worked somewhere like Google, which has infinite resources and wants to implement this same protective factor at an organizational level. They may be able to do a lot more. They may be able to have, a lot more expansive benefits around access to resources, or, allow their families to bring kids to campus and have childcare, high quality childcare, right? The point is that you have 2 very different agencies attempting to achieve this optimal condition, and they can, though their path is different. And that's what's really cool about the Empower Action model, is that we provide you with those optimal conditions, but the path by which you get there, or the things that you decide to do to get there, is going to vary based on the context of which you're in. And that's been a really amazing experience to even see in South Carolina. And I know Dana will talk a little bit about this, how different communities have implemented this model and used it to develop their action plan, and how they seek to achieve that optimal condition. Whether or not they're a small organization, or they're a coalition, or they're a group of parents, it doesn't matter what you are or who you are. It's really how you've decided to get there, and what are the steps that you're going to take there. So this is just a really cool slide when we are presenting the Empower Action model to folks in South Carolina. You can also look at the model as a way of bringing together all of the great efforts around building resilience for kids and families. And so here you can see how different parenting programs or child maltreatment prevention strategies and initiatives all fall under our action-oriented protective factors. And so you can even take a moment and think about how your program or your initiative, or what you're passionate about in child welfare, falls under one of these protective factors. Which one of these protective factors do you promote the most, right? And so there's a lot of different ways that the Empower Action model can be used. In addition to action planning, it can be a tool for us to acknowledge where there is collaboration and where there needs to be more, or to map out services that already exist but need to exist and we need more of. It's a very versatile tool in that way, that you can look at it in many, many different ways. So, with that, I will stop for a second and see if there are any questions coming in. But really, this has been a 2 to 3 year journey, because we really wanted to be intentional in creating this model. We wanted it to be something that our program partners like both internally, like Dana, as well as our external partners, had a lot of feedback, opportunities for feedback. And I think for me, as a community-based researcher, I didn't want this to be something that got stuck on a shelf. I wanted it to be something that was really, really valuable and useful and practical. And so what you see here is a beautiful illustration of how our communications team brought to life all of this great research that went into this, this model. And so with that, I'm going to actually pass it right over to, sorry, one more thing before we forget. So in addition to the Empower Action model, we created what we call the Ready, Set, Go guide. As I mentioned to you all, we worked earlier with Chapin Hall and the Office of Early Childhood to put together a readiness tool. It was very comprehensive, but very, very dense and academic. And so we distilled that down to what we call the Ready, Set, Go guide, which is essentially the readiness guide that you can use while implementing the Empower Action model. And it's broken down into 3 major steps: ready, set, and go. And Dana will talk a little bit more about what that looks like. Dana, I will pass it over to you.
Wonderful, thank you so much. We're going to come back to that action plan here in a few minutes. So good morning and good afternoon. As Aditi mentioned, and as you heard in the introduction, I am the Community Engagement and Training Coordinator at Children's Trust, which means I do lots of different things. But as part of that, I also serve as an Empower Action coach. So now that you've heard the history of the Empower Action model, I'm excited to get to share with you what using the model has looked like in the field from the perspective of a coach. So Children's Trust chose to pilot use of the model in 3 counties across South Carolina. These counties were selected based on high ACE scores and high child maltreatment cases, capacity or readiness to tackle this work, and because the counties represented different demographics. While it would be a stretch for any of you who have visited Columbia in Richland County, it would be a stretch for us to call our state capital a metropolitan area. It is more urban and has a greater number of resources than Marlboro and Oconee counties, which are more rural. I've served as the coach for Oconee County, which is on the left side, upper part of the state on your map there. As I go through these slides, I've labeled each slide as Ready, Set, Go, as you saw in the planning guide and Aditi just talked about. You can think of Ready, Set, Go as a PDSA cycle, Plan, Do, Study, Act. It operates the same way. So I won't really refer to that, but I wanted you to see at what phase of the plan organizations were or counties were as we move along. We began work using the model with community-based child abuse prevention or CBCAP funds in the fall of 2018. Funds have shifted to another funder since then, but we started off with CBCAP dollars. We had 2 key objectives. The first was for county coalitions to have an infrastructure in place to support the creation of a sustainable long-range plan informed by parents and caregivers to address the prevention of child maltreatment and promotion of child well-being, which is a very long sentence, but each of those phrases was very intentionally selected. The second objective was to actually develop the plan. And we originally anticipated starting in fall of 2018 that this process would take about a year. We originally kind of thought it would end in December of 2019. It took us longer than that, and we'll talk about that. So using a collective impact approach, this is the infrastructure that we used for the work. I just mentioned that building the infrastructure was one of the 2 objectives, but that took a lot more work than just what you see here on paper. A backbone organization identified by us at Children's Trust serves as the fiscal agent and has a staff person, not an FTE at any of our 3 sites, but a staff person who coordinates the project. The backbone agency then brought together key stakeholders, meaning anyone who could help implement a plan and anyone who could benefit from a plan. It's pretty much everybody. So making sure that we had representation of each level of the socio-ecological model to serve as our core team. The core team plans agendas, facilitates meetings, and provides continuous communication to all coalition members. The Children's Trust coach works primarily with the backbone organization coordinator and the core team, serving from the very beginning as a guide from the side rather than a sage from the stage. It was very important to us that this work be as community driven as possible, with us serving as support. The core team received lots of training on topics like collective impact, the Empower Action model itself, race, equity, and inclusion, adverse childhood experiences, protective factors, and we developed what's called a stat chat to help train our core team members on how to really effectively use data. The core team then identified and invited specific community members to serve on the coalition, again, representative of the socio-ecological model levels. Core teams have about 6 to 10 members. That kind of fluctuates from year to year at this point, and coalition sizes vary. We have some very large coalitions, and then we have smaller coalitions. But regardless of the full size of people who are considered coalition members, there tend to be 10 to 15 people who are at every meeting and are fully engaged. Now, the relationships piece is huge. And I think this is one of the pieces that you don't get the full extent of in looking at the background of the model itself. But for the structure to work, a great deal of time was spent building relationships. The coach spent time with the backbone organization staff, then with the core team. And I think it's important to note here that we spent time with the backbone organization staff. We don't think about interacting with the organization as a whole, because sometimes when we do that, we forget that we're talking about individual people connecting with one another. So a lot of time was spent developing those relationships. Once the core team was developed, we spent more than 6 months just building relationships within that small group so that there was a high level of trust and comfort with one another. We delivered numerous trainings during that time, which allowed core team members to learn together. Now, in the nonprofit world, we can get so focused on grant deliverables that we easily skip the initial investment of time building relationships and move straight to outcomes. We all do it. But the outcomes will be more equitable, inclusive, and tailored to the specific and unique needs of the community when we build relationships. We need to develop trust, understand our assets and opportunities, and tackle challenging topics together. We also have to make sure that those who will most be served by the plan are equally involved in developing the plan. That takes a lot of relationship building too. Oddity talked briefly about the action plan template. Or the original planning guide, and then there was an action plan template that went along with that. This is what we provided to our coalitions. I'm going to walk you quickly through the 3 components of that as I talk about the process counties went through to develop their plan. Because part 1 is an executive summary of all the work, I'm going to start here with part 2. This section involved a great deal of training. Have I mentioned that there was a lot of training? As the training coordinator, I love that. We did lots and lots of training. Once the core team and the coalition were formed, we began pulling data and gathering data, including county-specific information on ACEs, child maltreatment, and child wellbeing. We collected community asset surveys, a tool that was developed by Children's Trust, which measured knowledge and utilization of community, child, and family resources, and measured beliefs about the presence of protective factors in neighborhoods and across the county as a whole. Core team and coalition capacity assessments, also developed by Children's Trust, helped us to identify gaps in knowledge and skills among those members, while collaboration assessments for those groups kept us tuned into how well the groups were functioning. This was a neat piece for this project that I haven't seen in other projects. This was a critical tool for measuring the power dynamics, equity, and inclusion. Did everyone in the room at core team meetings feel like they had an equal voice in the actions that the group were taking? After looking at all the data, trends began to emerge, and coalitions were able to identify 3 priority areas they wanted their plan to address. Now, hopefully we all know and understand the importance of looking at data. But to give you one example of how looking at the data made a big difference, not just because we handed the numbers to community members and coalition members, but because we walked them through what that meant. One county went into the process already planning to tackle transportation, which they thought was a big problem. They had in their heads when they went in that they've heard about transportation in other meetings with other groups, and this is something this group has to do. But they found when they did the community asset survey that community members at large weren't worried about transportation. So this section is the meat of the action plan. Using the protective factors as the guide for tackling the identified priorities, members use the Empower Action Grid or framework. Oddity calls it a framework. We all called it that big grid because that's how everybody knew what we were talking about. And I just sounded really Southern when I said that. The grid or the framework crosswalks protective factors with each level of the socio-ecological model. So you see here a partial sample of a completed action plan using the protective factor of building resilience. Language under each of the socio-ecological levels shows what steps a county plans to take addressing their priority areas to build resilience. Oddity just talked to you about these conditions that we want to create. One county identified safe and affordable housing as a priority, but in the process of completing this grid, they recognized that there was public policy work they could do, but that it would take a long time. And they wanted to do something that could happen, address more immediate needs in the here and now. So they changed the focus from safe and affordable housing to strong communities and chose to address various protective factors by connecting neighbors with one another, establishing new safe places for kids to play and families to gather within neighborhoods, and working with landlords and public housing to make updates to properties so residents could be more proud of where they lived. This is another example using the protective factor of growing positive outcomes by promoting individual development. One county chose to support new Strengthening Families programs in this level. SFP teaches parents of kids ages 6 to 12 parenting and refusal skills and teaches the kids themselves life skills. Because parents and children attend the program together, there's opportunity for them to learn together and strengthen relationships. I will say that this process felt very daunting in the beginning for sites. It took a while for all of these pieces to click. This is where they saw how all the training they'd received, though, and all the prep work that they had done came together. I actually had my site after over a year of work. One of the members looked at me and said, "Now this all makes sense," which was both sad and wonderful all at the same time. While the process may have been challenging, though, this document also kept them focused rather than wandering into territory of just doing good things in the community. Each piece of this plan that they developed is very intentional. So when we look at the executive summary, this comes in the beginning part of the action plan document. But the goal for this, because it highlights all the parts of action plan development, we envisioned this being a tool coalitions could share with other potential funders, legislators, media, and any other key stakeholders. The first part of the executive summary, developing the plan, gave coalitions the opportunity to reflect on all their hard work and be reminded of each piece that went into the development along the way. It's really easy to start to forget all of the work that you have done. So being reminded of that was really helpful, but it also served as a checkpoint to make sure they'd spent time considering race, equity, and inclusion, engaging parents and families, and effectively applying the data throughout the plan. The who was involved section was a fun section too, as coalitions really started to examine all the people and organizations they had engaged with along the plan development process. Again, it served as a way to look for possible key missing partners who needed to be pulled in for action plan implementation. This particular county realized they engaged with the Department of Juvenile Justice, but never worked with the local sheriff's office or police department. So they're looking for ways now to address that gap moving forward in plan implementation. Then the last page of the action plan covers the what's next. This highlights those 3 main priority areas and provides a high-level overview of action steps. But the grid slides themselves provide a more in-depth look at how the priority areas will be addressed. This entire process of action plan development that we thought would be finished around December 2019 was actually completed December 2020. All of the plans were submitted and approved by the end of December 2020. So now, as implementation rolls out, and sites are about 9 months into implementation, Children's Trust is looking closely at how the model was used in both action plan development and implementation. You heard Aditi say that one of the reasons the Empower Action model was developed was to provide the how alongside the what. So we want to know, did the model allow coalitions to just put pretty action plans on paper, or were they able to really use it to support concrete strategies that they can use? Coalitions are also revisiting the model often to ensure their work is still focused on promoting the protective factors across all levels of the socio-ecology with a race equity lens across the lifespan. We're excited to see what each county accomplishes. It's been fun to see them dive into that piece of this work. And we'll continue working with these sites through at least June of 2022. So that's the overview of what things have looked like on the ground in our 3 counties. And now I think we'd like to open up for questions and answers. Sarah and Mary, if you have any that have come through on the chat box.
Yeah, thank you so much to both of you for the great presentations. If folks listening have questions, please put them in the Q&A box and we'll make sure we get to as many questions as we can. And I see they're starting to come in, but I'll start with one that I have. I wondered if you could speak a little more about the resources required for some of these communities to put a coalition together and invest the time and effort into this work. What have you learned about that?
Sure. So that's part of the readiness piece. We wanted to make sure that when we were selecting backbone organizations, that we were identifying groups that had lots of connections in the community. They're already a well-established group themselves. It was important for us to have well-respected organizations that were leading this effort, so that other agencies across the county would be interested in doing work with them. So that was a big piece. We chose different things in different counties. We had one county that started a coalition from scratch, pulling from connections that backbone organization already had. and then moving out from there. We had 2 other counties that really took already existing groups and somewhat morphed them into the coalition to do this work. So depending on what a community has in place already, that would impact where a community would be able to start with using the action plan guide and using the model itself.
Great, thanks. I see a comment came in from Andrea talking about promoting equity. She says, one question I heard from an amazing coalition recently was to ask and keep asking, who is missing from this coalition? And in this example, she said the coalition had a process to keep adding and advocating for those missing from the coalition to join. And for example, adding incarcerated parents' voice to the coalition. Did you see that in your pilot, a process like that as well?
Yes, and in some ways that probably it became such standard conversation after initial trainings where we talked about race equity and inclusion and making sure that we had diverse voices. And that's not from a race or ethnicity standpoint, but also looking at socioeconomic status, looking at parents who have been involved with the child welfare system, parents who have been involved with the criminal justice system. We wanted to have a full gamut, foster parents, anyone who cared about children. We wanted to make sure that we had strong representation of all of those groups at the table. So we were consistently asking who's missing. That was kind of, and even now that they've moved into implementation stage, they're still having at every meeting these conversations about who's missing, who else do we need to have in the room.
Great, thanks. Our next question is about how do you get train others and share this information with others to implement?
You can reach out to Children's Trust. We have done some training with several states. We have not yet provided, had the opportunity to provide sort of some ongoing technical assistance around the model once that initial training has taken place, but we are open to being able to do that as states are interested. I think, Aditi, did you have any other thoughts on that?
No, I think you nailed it.
That's great. Yeah, because another question, how do you start this process? And I was planning to ask you what advice you would give to someone from an organization that would like to do something similar to this. It sounds like you all can provide some technical assistance, perhaps looking at those readiness tools as a starting point. Any other resources you would point people to or recommend that if they would like to dive into something similar?
So I think one of the reasons why it was so important for us that this was an open access publication and tool was that we want people to use it, and maybe it won't be used as comprehensively. You can see how we have many layers, many funders at play, and it doesn't have to be as intricate as our process. It could look very different. So what my advice would be is, first of all, make sure that whatever group or entity or organization wants to work on this has shared language and understanding of the key concepts that we are talking about, right? So make sure there's a deep understanding of ACEs before you jump to the so what, how do I do this? And there are certainly points in the readiness process, whether it's training or, some of the great resources that are out there on protective factors and ACEs to make sure we have a grounding. And then, start to really think about what are some things you actually have. You can actually just use the framework/grid to map out those existing services as a starting point. You don't necessarily need, one of us there to provide technical assistance. So there are things you can do on your own to get started. I think you just need to make sure, going back to what Dana said, was you have to have the right people at the table, committed people at the table that can get this off the ground. And people that are willing to be consistent over time as your plan comes to fruition and changes, or COVID happens and you have to go, completely to virtual implementation. So I think those are the things you need to do first. Don't worry so much about doing it perfectly or exactly how South Carolina did it, because how we did it wasn't perfect at all. We learned a lot along the way. It's just one way. And I think that this is work that's being recognized by a lot of different types of funders, local, state, and national. So I think that it's also, even just engaging in the readiness process could give you what you need in order to then apply for, a mini grant or something to support some of the work that you're doing.
Great, thanks. I wonder, Oddity, if you could speak a bit more about measuring success, looking at indicators, evaluating what's working, what's not working, bringing data into this process, and speak a bit more about that piece of this work.
So if we had 2 hours, I would go over our evaluation plan. We did create a very comprehensive evaluation plan that included, again, some of the great work that we had already done in partnership with Chapin Hall and Colorado Office of Early Childhood. They had created some tools, and then we created some of our own. And I think that speaks to, the value of having research and evaluation in-house at Children's Trust, as we had that expertise and we were able to create that. So just to give you a broad overview, there were definitely some key constructs we wanted to measure. Some of that came out of coalition specific research that's happened in the past, whether it's like collaboration of members, looking at cohesion, looking at asset mapping, do you have a general understanding of what exists, what doesn't exist? And then what we call capacity building, which I know is like a buzzword, but in the context of this, it's, do you now feel comfortable being able to teach these same concepts you're using to other people if we weren't there, right? So those were some of the things that we are looking to measure and have been measuring. Again, not a perfect process. We had some staff transitions that caused us to maybe delay or change our timeline a little bit. But yes, we have a comprehensive evaluation plan. And I think the next step would really be, now that there's a, the framework is out, the model and framework is out there, the next step is now to do an implementation study of how things went using coalitions. But again, specifically for us, it would be the effectiveness of coalitions using the Empower Action model. For you all, it might be looking at the effectiveness of your organization using it or some other type of entity. So I want to be very specific about that. And so we had short-term outcomes, of course, that looks at some of those member dynamics and changes in how people are collaborating, what programs exist or what programs are now coming in. And then, of course, our long-term outcomes were really starting to see the data change around ACEs and maltreatment and kids count data around well-being.
Great, thank you. A few additional questions I'm seeing in the chat. Ashton wants to know, can you remind us when it started? So can you go back over the timeline?
Yes, so, I'm sorry, go ahead.
I was gonna say fall of 2018 is when we first started working with counties, and their plans were finished by December 2020. And they are in the process right now of implementing those plans, and will go through they're going to be implementing those plans for years to come. But in terms of having support and more detailed, intensive TA from us, that will go through at least July 2022.
Great.
And I see here too that somebody asked about how do you help people come to the table who are struggling with daily life and can't make a time commitment? That's a great question. And one of the, I guess, silver linings of COVID was that moving all of our meetings to the virtual space allowed more people to participate. Folks who only had an hour that they could take during a lunch break. We weren't serving them food anymore, which stunk, but they were able to attend those meetings because they didn't have to travel to get there, that sort of thing. But also that continuous communication loop was huge there, so that if folks weren't able to attend meetings, they still every month were very much up to date on what was happening. getting minutes from those meetings, but also getting asks, action steps that people needed to take before the next meeting. So we worked to make sure that everyone felt like they had a role to play, whether they had a whole lot of time to commit or not.
Wonderful. Well, thank you both so much. It's wonderful to hear about your success in South Carolina, and I appreciate you sharing it with us today. And thanks to everyone who attended today's webinar. Feel free to reach out to our presenters at their contact information if you want to learn more about their work, and hope to see everyone at our next session in October. Okay. Thanks, everyone. Bye.